the mic someplace else.
Oh.
Probably not do introductions. Don't do introductions.
No. Good afternoon. I'm going to go ahead and call a special meeting to order, special meeting of the Columbus Board of Health. Our first item will be to administer the oath of office to Board Member Karen J. Morrison. Mr. Tobias.
Thank you. If you could just raise your right hand, please, and repeat loudly and clearly after me. I, and then state your name,
Karen Morrison,
do solemnly swear
that I will support
the Constitution of the United States
the Constitution of the United States
and the Constitution of the State of Ohio
and the Constitution of the State of Ohio
and the Charter of the City of Columbus,
and the Charter of the City of Columbus,
and that I will faithfully, honestly, and impartially discharge the duties of the office of member of the Board of Health during my continuance in said office. And I'll have you sign this for me.
I thought you said 14. No, it's 13.
Thank you, Karen. We appreciate your willingness to continue to serve and role. It's been very important to me. We're glad that you're still a member of the team. Our next item is to authorize resolution number 20-08 to declare a state of public health emergency in the city of Columbus and Worthington pursuant to Chapter 775 of the Columbus City Health Code and Ohio Revised Code 3709, which confers upon the Board of Health and the Health Commissioner emergency powers to address imminent threats related to health of the public. I'm going to go ahead and read it.
Does she need to read the whole resolution?
And then ask for a
Does she
motion
need to read the
to
resolution?
approve.
That's probably a good idea.
Okay.
Let me just say that this is lengthy. It's important, but it's lengthy. Resolution number 20-08, whereas on January 30th, 2020, the International Health Regulations Emergency Committee of the World Health Organization declared the outbreak of COVID-19 a public health emergency of international concern, and whereas on January 31st, 2020, Alex M. Azar, Secretary of Health and Human Services, determined and declared that a public health emergency exists in the United States in relation to COVID-19, and whereas currently the Centers of Disease Control and Prevention, CDC, lists over 129,000 worldwide cases of COVID-19 in 88 countries and over 4,700 deaths. And whereas on February 1st, 2020, the Ohio Department of Health issued a statewide health alert network to provide local health departments with updated guidance for COVID-19. And whereas on March 9th, 2020, testing by the Department of Health confirmed that 3 patients were positive for COVID-19 in the state of Ohio, creating a potentially dangerous condition which may affect the health, safety, and welfare of citizens of Ohio. And whereas the state of Ohio is experiencing community spread of the virus that causes COVID-19, and whereas on March 9, 2020, Governor Mike DeWine signed an executive order declaring a state of emergency for the entire state of Ohio in relation to COVID-19, a respiratory disease that can result in serious illness or death, and is caused by the SARS-CoV-2 virus which is a new strain of coronavirus that has not been previously identified in humans and can easily spread from person to person. And whereas the governor's executive order declaring a state of emergency for the entire state of Ohio urged all citizens to heed to the advice of the Department of Health and other emergency officials regarding COVID-19 in order to protect their health and safety. And whereas on March 12, 2020, the Ohio Department of Health issued an order prohibiting mass gatherings throughout the state of Ohio. And whereas on March 12, 2020, the governor declared that all K through 12 schools throughout Ohio will be closed effective the afternoon of March 16, 2020, and remain closed for a 3-week period of time. And whereas in the city of Columbus and Worthington, there is an imminent threat of an acutely hazardous disease, illness, or health condition, specifically COVID-19, that is believed to be caused by the appearance of a novel infectious agent. And whereas in the cities of Columbus and Worthington, this imminent threat of an acutely hazardous disease, illness, or health condition poses a high probability of widespread exposure to an infectious agent that poses a significant risk of substantial harm to a large number of people, a large number of serious or long-term disabilities, or a large number of deaths. Be it resolved by the Board of Health of the City of Columbus, pursuant to the authority granted by Chapter 775 of the Columbus City Health Code, Ohio Revised Code, Chapter 3709, and the contract between the Columbus Public Health Department and the City of Worthington, executed on December 2nd, 2019, and approved on January 27th, 2020. A state of public health emergency is declared in the cities of Columbus and Worthington. Section 1. The entire jurisdictions of the city of Columbus and Worthington are subject to this declaration of public health emergency. Section 2. This declaration shall take effect immediately and remain in full force and effect until terminated after a finding that the occurrence or condition that caused the public health emergency no longer exists or is threatened. In any event, this declaration shall automatically be terminated after 30 days unless renewed by the Board of Health and/or the Health Commissioner. I ask for a motion to approve this resolution.
So moved.
Is there a second? All in favor? Aye. There's unanimous support. Thank you. Thank you all. And with that, I will ask for a motion to adjourn the meeting.
So moved.
Second. All in favor? Aye. Thank you. Thank you.
Dr. Weavers, do you want to sign this with me real quick?
Oh, sure.
Ohio.
So this declaration talks about a public health emergency. Let's show you, if we can, a little bit about what this may include. If we declare a public emergency, I think we have a little bit for you on what a public health service determines a disease or disorder presenting a public health emergency in effect. Public health emergency including significant outbreaks of infectious disease, bioterrorist or otherwise exists, which obviously with this coronavirus, this gives the county a little bit more power to do some things that they wouldn't ordinarily be able
Absolutely.
to do.
Dr. Mashika Roberts and Mayor Andrew Ginther held a news conference here about 11 o'clock this morning, and she specifically talked about doing this because some people, of course, will go because they know it's the right thing to do. They will self-quarantine. But she said in some instances they do have to force people to do that, and this gives them the right. They can bring in the Columbus Police Department and force someone to be isolated or to go into quarantine.
Yeah, the order allows quarantine, isolation of individuals, including city employees, but also allow for police enforcement of those quarantines. allows the health department to control entry and exit from public areas to prevent hotspots in buildings or neighborhoods as well. So this gives that power, now under that power.
Yeah, our reporter Rob Sneed has been standing in that room there while the Public Health Department got together and talked about this resolution. We're going to toss it on out to him for an update on more what's going on there. Rob, what can you tell us?
Yeah, they just concluded the meeting just a few seconds ago, actually. And as you guys mentioned, now that this is passed, she is allowed rather to speed up the process of quarantine, to order individuals to be tested if she suspects that it is a public threat, and also to isolate and identify hotspots to allow the people to be informed.
Lieutenant Governor John Houston, Kim Hall, the Director of Jobs and Family Services, Leanne Cornyn, who is our Director of Children's Initiatives. Let me first start in regard to testing. What we're starting to see now is more tests that are occurring. We're seeing the Cleveland Clinic, for example, that reported today they had 4 positives. University of Cincinnati Hospital at the other end of the state, they reported 4. None of this should surprise us. None of this should alarm us. All of this was very predictable, and is exactly what the experts have been telling us and what we've been sharing with you. We believe that there are many people in Ohio today who are carrying the virus. And so in the days ahead, you're going to see more and more reports out there. But again, our best judgment, based on our medical experts, is that the coronavirus is already all over the state of Ohio. And so just want everyone to put this in perspective. Not unexpected, fully predictable. And so you'll see these numbers, they will get so numerous in the next few days that I never want to guess what the news media is going to report, but at some point, it's not going to be news anymore. So I just want everybody to kind of understand exactly where we are in regard to that. We are announcing that we will be issuing an order for our county jails as well as our community-based correction facilities around the state. This really follows what we have done with our prisons. And the order, of course, is no visitation. We also ask that in each jail and community correction facility that other protocols be put into place to make sure that everyone who comes into that facility, that there is no one who is sick. And those would be similar to the protocols in regard to nursing homes. Again, the principle is the same. You have a number of people in a confined area. You need to try to limit as dramatically as possible the opportunity for someone to come in and introduce the virus into that facility. Nothing is perfect, but we need to certainly do the best that we can. In regard to our juvenile courts, we know that they have been the juvenile court judges who run juvenile detention facilities across the state are also working with the Chief Justice to come up with protocols. And we would hope that those, and we're sure that those will be similar to the protocols that we've announced in regard to the county jails. We have, in the last few days, announced some very tough measures for the people of the state of Ohio. My commitment, this administration's commitment, is that we're going to do everything that we can to build support, build help, build systems to help people get through what is going to be a very tough time in the next few weeks, maybe the next few months. we're really working to build that support system. But it is a work in progress, and we're putting it together each day. Let me turn to our schools for a moment. Well, we asked the Trump administration, Department of Agriculture, to give us some waivers. I'm very happy to announce that they have given us those waivers. We're very grateful for that. Very, very quick turnaround, less than 24 hours, to enable our schools to help continue to feed the students who they have been feeding lunch, and in some cases, many cases, feeding breakfast. It's going to be up to each school. Each school is different. Some are urban, some are obviously very large geographical areas. But we know from talking to superintendents that they want to do this. They will continue to have their staff, and so they will be able to work that out. But what the waiver what was granted us allows us to basically package this food, allows the schools to package this food in whatever is the best way to do it for them, and take that out to the students and students. So that is something that, again, is a work in progress. But we have cleared any kind of hurdle out of Washington. We're very grateful for that. You know, some people refer to these as the grab-and-go meals, but it's some way that you can take these meals home. I'm sure some schools will have different, every school will have different distribution procedures. Some schools will have more difficulties than others. But our departments are working with these schools to make sure that this works. Very, very important. We know that there are some children who really rely pretty much exclusively on that food that they can get from school. We've also seen our food banks, and I want to give a shout out to them. I got some texts from some of our food banks last night who said, look, we want to be part of this, we want to help, and I know that they are engaged as well. We announced yesterday that our schools would be closing at the close of school on Monday. I know some schools have actually already closed. Some schools are using today as the last day. That's fine. That's entirely acceptable, and that is up to them. We have had some inquiries if there are exceptions, and the answer sadly is there are no exceptions. These school buildings will be closed to children, to the students, beginning at the close of school on Monday. So there will not be any exceptions to that. Learning, though, will continue. And yesterday I was trying to, I guess, make a little light of it and referenced for our students extended spring break. That's probably not the way to look at it. What we're really talking about is schools that want to continue. All schools will be looked to continue that child's education. So the teachers will stay on, everyone else will stay on, and the education will try to continue this. Now, each school is different. Each school is very, very different. And so what one school can do, maybe another school cannot do. But our request to every school is that you do everything in your power to keep education going during this period of time. This is a 3-week period of time, but quite candidly, we don't really know if 3 weeks is all it's going to be closed. The school building itself will be closed. So no matter how long this is, education needs to continue for our young people in the state of Ohio. We do expect schools to keep the learning going. There certainly are a variety of ways that schools can extend students' education even when they're not in the classroom. Many schools have plans, I know, from our office, myself, talking to them for online work, online learning options. I would point out that there's many opportunities for them to do that. There's a wealth of free online resources, such as the Khan Academy, that schools and educators can share with their students. We also know that some schools are not in a situation where they can have that online learning. They will improvise, they will do the best they can do. They will look at this to some extent, maybe as when a student has an illness, sometimes students are off 2-3 weeks, and schools have figured out how to deal with that. Besides school, there's ample things, obviously, for children to do. One of the things that we encourage not only children but adults to do is to explore the outdoors, stay within 6 feet away from everybody, but there's plenty of space out in the woods and plenty of things to learn out there. Children certainly can read books. Anyone, I would say, who has not signed up their child for the Dolly Parton Imagination Library, it is open in virtually every county, and we hope in the next month or so to have it in every single county. But most Ohio children are now covered. They can go online, the parents can go online, again, that's birth through age 5, they can sign up for that. That may keep the younger members of the family focused, or maybe some of the kids who are in school can read to their younger siblings. Just many, many things that can be done. We are aware, and we've been told by some schools, that many of the lesson plans teachers have prepared for calamity days have not had to be used, and so those can be used. We will work with school leaders to make sure they have the flexibility that they need. And so every school is different. Every school situation is different. We want to be as adaptable as humanly possible. The schools have a big task. We know it's a difficult task. Again, I want to salute our teachers who do such a great job every single day. The teachers I have talked to have embraced this and have said we're going to get the job done. So this is tough for them, but I want to thank them and use this opportunity to speak directly to them. We are grateful for what you do. We are grateful for what you do every single day. And as we go through a crisis that we've not lived through, most of us have never lived through before, you are really at the forefront of this as you continue to educate our children during this period of time. It's more difficult because we don't know how long that period of time is. So thank you for doing that. Thank you for taking this on. We're very, very grateful. Let me now move to another area. We have prepared a letter. I told you yesterday about a letter that we were preparing to the Trump administration. And I'm going to ask John Husted, who has been working on this letter. And I think, John, by looking at it, it's expanded beyond what it was yesterday, and we keep adding a few pages. But these are things that we need to get some waivers. So again, our whole goal, some of the tough decisions have been made, unpleasant decisions about closing schools, unpleasant decisions about nursing homes, unpleasant decisions about many, many things. But now our job is to do everything that we can to help people get through this and to create the systems that are there for support. John? Get that out of your way.
Thank you, Governor DeWine. I want to reiterate that again, that we are attempting to build that support system around the people of Ohio and our businesses and institutions who are coming together to help us get through this difficult time. As part of that, we sent this letter, Governor and I, to President Trump and Vice President Pence earlier today with requests from our agencies on regulatory and other relief that is necessary. We copied our congressional delegation. I have received calls and I know I'm sure the governor has, from both members of our congressional delegation and our legislature asking to be supportive of these requests, and we appreciate that. As I mentioned yesterday, the genesis for this is that we've asked state employees to limit their person-to-person contact. But some of these state employees are the very inspectors and regulators that institutions, businesses, employees rely on to keep the flow of work going. There are a lot of issues that they need to address every day, a lot of things in the pipeline. And those institutions, people, businesses need relief as the regulated on the work and the services that they provide. One example, the governor gave a great example of this, something that the Trump administration was quick to respond on, was the USDA waiver that we requested. We have essentially an additional, let's see here, 17 requests that are in this letter, and these are waivers on things like inspection that are tied to funding, audit requirements, and the like, so that there is no or minimal disruption in these services. We don't, as I mentioned, want any regulatory delays any more than is necessary. Let me highlight a few of these issues that are in the letter so you get a feel for what we're talking about. We expect one area that could be affected are staffing levels, for asking for a waiver on these recertifications so that these individuals are not disrupted, or their institutions, in providing those services. Another approach that has been requested is asking for support of federal FMAP funding, medical assistance percentages. Right now the federal government and the state government share that cost, as has occurred in previous recessions and difficult circumstances. For example, 9/11, we ask that the federal government take a bigger share of this, and then the state resources then can be put in to the response to the COVID-19 pandemic. Additionally, we are asking access to the national stockpile of personal protective equipment. We are going to be soon in need of access to this equipment to keep our health care workers safe. They are on the front lines of this. They are to be commended and thanked for their service, and we need to ensure that we are supporting them with the resources that they need. Again, we understand, and I believe the Ohioans are beginning to understand the challenges that lie ahead, and this is just one step forward on building that support system that they will need, we will all need to get through this. We are working on recommendations from business leaders. We are working with local governments and other providers on expanding this list. This will not be the last time that the President, Vice President, and the congressional delegation hear from us. We're quite sure of that. But at this moment, everyone is coming together. I know I've been uplifted by some of the calls from businesses who, after the governor spoke of price gouging, that promised that they would hold prices, particularly for necessary and critical equipment, where they are. We've had internet service providers, upon the cancellation of school for 3 weeks, offer free internet service for families who have access to that broadband where they can sign up. The people of Ohio, the leaders of Ohio are responding. They're coming around this. This is pulling us together, and we're going to do our part under the governor's leadership to continue to make sure that state government is playing its role. Thank you, Governor.
Thanks, John. Let me talk for a moment about our daycares. Daycare facilities, we are not closing them at this point, but that is something that may occur in the future. And so I would ask anyone who is a parent who is using a daycare to start thinking about what their alternative would be. We know how difficult this would be for many Ohioans, and what a burden it would be on them. But daycares are unique, And anybody who's had children understands that or has seen their grandchildren. They pose really a unique, what I would call a unique risk. Kind of hard to enforce the 6-foot rule, and children share things, and we have all kinds of things going on in daycare. So that's just the nature of kids. So we're not closing up at this point, but people need to start thinking about alternatives. If you're in a position, economically, otherwise, and can figure out how to do it, the recommendation from the medical community is that you remove your child from daycare. If you can do that, that would be advice. I think that would be good advice. Again, as we talked about yesterday, children, unless they have a medical problem, pre-existing medical problem, they're probably going to get through contracting the virus okay. But they are carriers, and just like all of us are potential carriers. And so these potential carriers will come home, and this certainly can spread. And this would include people who have daycare or don't have daycare, but if your person who is taking care of your child is 60 or over, need to look at that. Again, not because of the child, but because of that person who is 60 and over. And I know that, as these changes are made, and in society generally, we have some grandparents who are in that age bracket or older who are caring for children. And we're just simply saying that, just pointing out that the risk, it goes up, and it goes up rather dramatically the older that person is. I think everybody just needs to be mindful of that, and we need to continue to say that. Jobs and Family Services has put out protocols to the daycare centers in regard to what extra effort to take to keep from the spread, or to try to cut down on the spread of the virus. We would again remind daycare, as well as every employer in the state, if someone is sick, send them home. Be mindful of whether someone is sick, even if they don't tell you they are. Because many of our daycares have done this, we're seeing some daycare centers that are short on people. We can only expect that to continue to get more critical and pose a more problem for daycare centers. Kim Hall is here and can answer any questions, but we're changing some regulations because of this emergency. We have regulations in regard to a teacher ratio to the student. We're going to be relaxing those again because of the fact that we want a person to be going home if they're the teacher, if they have a cold, if they're sick, if they have a fever. We are also, Jobs and Family Services is also working with the providers to make sure they can weather this storm. We will get through this. This will last a while, but it will be over, and we'll be back to normal. And what we want is that the daycare providers to continue to exist, and that they make it through that storm, because when we're done, they're going to need to be there. And so Jobs and Family Services is working with them to help make sure that they are there. Finally, before I turn it over to Dr. Acton, I voted today, and we just would encourage everyone to vote. Polls are still open. I think they're open, John, until 7 tonight. They're open tomorrow. They're open on Sunday. They're open on Monday, and of course they're open on Tuesday. My experience in Xenia where I voted was there was a line, but it was a line that moved pretty quickly. So I think you're seeing this voting spreading out, and we would just encourage people to vote. The polling places are taking precautions. There's hand sanitizer everywhere. When I walked in at Xenia, they're wiping off the screens, and everybody in line was mindful of that distance. This is important, and we need to move forward, and everybody needs to vote. So let me turn it over to Dr. Acton. Amy?
Thank you. Good afternoon, everyone. I first want to start out with some of our numbers. As you know, and I apologize to the reporters here, you're going to see as these numbers go up and some of the news of the day that our website, while we regularly post it to, some of that will change as the activity goes and different people announce more at the local level. We receive all that data, but it might not be. So I'm going to share with you what I know as I know it. Right now, for certain, we have 9 males and 5 females. We now have an age range of cases, 34 years to 66 years of age, with a median age of 48. And their illnesses, not the case, because as we know, we started testing. Our first case was, I believe it's been a long week, Monday. But their illnesses started as far back as February 25th and as recent as 3/11. We've had 4 hospitalizations, no deaths. The number of counties with cases, and you'll be hearing more as more and more test results come back today. 6, we have Belmont, 2, Butler, 1, I think there's more information coming there. Cuyahoga, 6, Stark, 2, Summit, 1, Trumbull, 1. Again, it's very hard to keep up with these numbers. I'll explain that. Cleveland Clinic did get the ability to test and went live today. So they're actually doing their own testing, which is helping speed this up. And Dr. Wiley shared with me this morning that they can do 500 a day. So that is our first big surge forward in testing. And UC did announce 4 cases, I believe, as well. They have another under investigation. But they're doing a combination of our lab, and they did have, I think LabCorp was involved, a private lab. So all that comes back to ODH, and we'll summarize that and be printing that out. We do have 50 negatives. We have 159 under investigation. So again, we're up operating three testing cycles. Our EPIs are now on, our epidemiologists, our disease detectives are working 2 shifts of 12 hours. I do want you to know when we talk about testing and even some of the drive-through testing that the hospitals are trying to get underway, you must have a doctor's order. Health departments don't do testing. You really need to talk to a doctor, preferably at this point call them, and they'll talk through this with you. As we see this disease spread, we will know that most of us will hopefully ride it out at home. That's so important. So you'll need to talk to your doctor. They'll decide and do a thorough history with you and decide about that testing and give you instructions on how to do that. So with that in mind, I must say I didn't mean to go viral yesterday in any way, and that has led me to want to give a little bit of a science lecture. For those of you who know, I was a professor of global public health at Ohio State for many years, and I'm going to go quickly because I know it's tiring to stand up here, but I think this is so important. I'm going to do my very best to kind of break this down in a way that's understandable. I want to walk you behind the veil of what's been happening with all of this. I've told you all along that there are, ever since 9/11, there's huge effort on preparedness that goes on at the federal level, at the state level, in my department, and at the local level, and that involves many players. And so we've had these pandemic plans, often based on flu research, and those are all underway. They're there all the time, and we were certainly working ours from the beginning of hearing the first cases in China. And as you've seen, the heroic efforts that the CDC and the federal government are taking. I've said all along that these things are not perfect. I have to keep reminding my own team and myself that if we can get this 80% right, that still makes a huge difference. And if you remember, on that curve, everything we're doing is trying to decrease, slow this disease transmission down. We know it's here. We're slowing it down. We're trying to decrease that logarithmic spread of one person giving to 2 to 3 people and on, so that people stay safer, that we keep you healthy, but also so that our health system can handle the sickest patients. When you are involved in this work, and my colleagues around the country, you'll understand what I mean, and somebody had this famous quote, on the front end of a pandemic, you look a little bit like an alarmist. You look a little bit like a Chicken Little, the sky is falling, and on the back end of a pandemic, you didn't do enough. And that is your fate in my role, and that will be the fate of all of this, because whenever a pandemic has come and gone, or any infectious disease, a preparedness also has an end evaluation. We do a hot wash. We do something called after action, and we look at everything we did and we learn from it. So part of this, learning from the past, actually for me, began with the people who actually invented this curve and who actually invented these plans. As late as this morning, I was on the phone with Dr. Rajiv Venkaya, who was actually working during H5N1 with President Bush. And in the White House, they made this strike team of, I believe it was about 7 brainiacs, to begin some of this complex modeling to try to decide how do we react in a pandemic when we don't have any drugs yet. They invented this whole field of staged interventions and community mitigation with many, many colleagues in the CDC, but that's where it all began. But they actually went as far back as the Spanish flu. So, 1918. And it's so interesting, poor Spain, because they did a lot of the right things, but it got named after them. But in this country, and what's so important, because timing is everything, in a 2-week period, one city took dramatic actions, St. Louis, and 2 weeks later, Philadelphia started doing the same actions. And the trajectories for the two cities were widely different. So we know that balancing the right action at the right time is so important. This work, bird flu was was more deadly than the regular flu, but it wasn't very infectious. H1N1 came along in about 2009. It was spreading more, but it was actually less fatal than the flu. In 2007, there were recommendations made that form a lot of what the CDC is putting out. In 2017, those were looked at again, very famous, and I encourage you all to look at the MMWR from April 21st of 2017. That's a lot of the post-action on H1N1 and what we've learned about flu. But of course, we're in a time where it isn't the flu. This is coronavirus, and every day we're learning something new. And I know that confuses people because, there's multiple conflicting ideas, and experts who do this modeling will differ in how they think it should be done. But by and large, there is a playbook, and we're all executing it, and it's going to unfold in one state here, one state there. It's going to inch its way forward, but that's what you're seeing unfold. When you're a leader making these tough decisions, you have to get the best advice. And all along, when I advise the governor, as does dozens of experts that have been assembled, we give him our best advice with the best information we have, and that has varied moment to moment. But, we work with the government, we work with the CDC, the White House, ASPR. We work with all sorts of disease modelers. But we also work at the Ohio Department of Health. I have 1,100 employees, many of whom are moving through those same step down to work at home today. I just want to say to them, Thank you for all you're doing. I'm going to talk to you soon. This has been crazy, but I'll talk to you more about what's ahead for you. But 113 local health departments in a state like Ohio, where we are very decentralized, they have their own boards and own health commissioners, but they're on the front lines with the plan right now. Those are the ones I told you to send the cookies to. They're working tirelessly around the clock, sleep deprived right now. They're working with mayors, schools, all our hospitals, philanthropy, businesses, heavily involved. And then also, they're the ears on the ground. So information I'm taking in is coming from communities. Every doctor I've ever known in Ohio is calling me, telling me, we can't get equipment, we can't get PPE, or I need your help on this. So all of that from patients and their questions coming to our hotline, all of that information we're taking in and charting a course. So what we are instituting right now has 4 simple rules, and it's called, we went from the containment phase where we hoped, with early diagnostic testing and isolation and quarantine and borders, the dramatic moves that the president took to contain it, but eventually we always knew we'd reach mitigation. And this is very important here for people to understand. It's early, targeted, and layered interventions, early, targeted, layered, and timing is everything. There's also a matter of how severe a pandemic is, and when you look at the guidance that the CDC put out on schools, it goes from what is guesstimated to be mild to moderate to severe, and that impacts the duration of the interventions you put in place. Now, this disease is interesting for several reasons, and it's different than H1N1 in some circumstances. The travel that we do now is different than 2009. Our dependence, we've learned a lot about, and we'll learn a lot more in days to come about, the PPE, where it's manufactured. We will learn a lot about our medical supply. Our communications and our social networking, all of that is a little different, and it's factoring in, plus the fact that our studies are ongoing all the time. So what are these 4 interventions? They save lives, and they have to be implemented together. If you are sick, number 1, if you are sick, stay home. That is isolation for the ill. Isolation equals ill. 2, if someone in your household is sick, and we've talked a lot about households, you stay home too, and you quarantine. So quarantine is for people who might have been exposed back when we had our 200 and some travelers, but it is for people who should stay at home. 3, social distancing and isolation. That is our 6 feet. That is our mass gatherings eventually as this progresses. That is getting us out of socially dense situations where we have rapid transfer, again, 1 person to 2.28 people now on best estimates and onward. These are the individual controls as well. Everything, keep doing it. It so works. The hand washing, the coughing, the not touching your face, which I'm desperately trying not to do. It's hard, I know. And all these things are what matter. Now, last stage, of course, are the things we've taken. School closings, and eventually, if needed, the daycare closings. Those are the hardest, and you'll hear experts debating about this forever on the networks as we speak. And it is because you have to take the risk benefit of it. You have to think about your nurses who have kids in school and you need that workforce. You're weighing elaborate groups of things, but even in the modeling, they took this into account, and they have what they call cascading consequences. And we're rolling out, we have to move quickly in this case, so we're doing our big rocks, but in the days to come, and just this day, Director Hall, and you've heard about the work she is doing, we will keep layering and layering this response with all the supports that people need. But that is how this works. Now, this is a key point. It's not perfect. Any one of the 4 interventions themselves only does so much. It's like Swiss cheese. Like you have 1 piece of Swiss cheese and you've got some holes in it. But if you layer Swiss cheese on top of each other, if you do it just right, you can cover up a few more of the holes. It gets harder and get through. So you've got 4 Swiss cheeses. You're getting about 80% maybe. That's a guesstimate. You'll have to live with me on guesstimates in this world. And therefore, you're getting more impact. And as I said, timing is everything because it's a lot like a fire. These non-pharmacologic interventions that stall us and slow us down are like when you have a fire on your stove and you have your kitchen extinguisher, you want to get it quick and you don't want the fire to get out of control. And so you really want to beat that upward slope of infection. Now that's tricky, and experts are going to disagree, and there'll be postmortems. But you know, when I talk to my colleagues in Washington, they wish they could have done more sooner. And so we're learning from Italy, we're learning from some of the data we're seeing around the world. Interestingly, kids are getting infected. There's one study, I just want to mention this, Japan, because of the Princess cruise ship, that was the one place they actually tested kids, and they found that there are amplifiers. They get infected just as much. They don't get as sick, but they do, and that's why schools and the nasty stuff you were mentioning are important. Now, you can also go too soon, you know, and so it's a delicate balance, because if you go too soon, you exhaust people of doing these measures, and you fatigue folks. But the truth is, we are at that point, from all indications we're seeing, where we're on an upward slope enough that we know, and with the lack of PPE and other things we're taking into account, that moving now is disruptive. It's going to be disruptive because we're going to get there anyways. And the sooner you go, and if you do them together, that's the impact we're after. And we hope we do this well. We hope, again, we mitigate this and we see that drop. Whatever we do will help at this point, and that is what we're doing. Now, very quickly, this is my complex study of predictive analysis, the kind you do on a piece of paper. We know a lot about this disease, but as you know, our diagnostics have been slower, and with our testing, we were sending to the CDC. It took 5 days, but once we've had this testing, we're ramping up. We don't know, for epidemiologists, they have to look at a lot of things. We're looking at the early studies. We're making best guesses. We're talking to the experts who made the model. We're talking to our CDC colleagues. But we can assume a couple things. We can assume, from what we've been hearing, that there's a peak of maybe 40 in some circles to 70%. I've heard numbers as far-ranging as that from experts about how much of the population will eventually become infected. We know a little bit about the R-naught, which is how much one case infects others. It's roughly estimated, again, these numbers will change, at 2.28. We assume, from some early modeling that we've heard on thousands of calls I've been on with thousands of experts. Again, I take the best data. I hear conflicting. I usually use the more cautious and conservative of the data. There may be a peak of this, again, guesstimate, still, the modeling is still working, of late April to mid-May. So we took that number backwards. We also know that there's a serial interval, which means this thing is doubling. I've heard as little as 5 days and as much as 7 days. So 5 to 7 days, we're taking 6. So we have guesstimated a peak, and we went to mid-April. We said 60% infection. We worked our way back by the weeks, and we came back to what would 1% be. We roughly guesstimated March 9th. And our population, I have 11.7 million Ohioans as my patients, and we said, we know we have community spread. The data that comes out today will clearly show that these cases don't have a connection to anything we can point them to. We know that we have ICU patients. That's a big trigger for these interventions. We do not have a death yet. We know deaths often lag hospitalizations by 3 to 6 weeks. So even in South Korea, even in Italy, a lot of the data is still behind. And so we used all of that. I think the LG and I, he helped me say, what's 1% of 11 point, no. But, so we are saying, I'm not saying there are absolutely, for certain, 100,000 people. I'm saying I'm guesstimating. If I'm guesstimating community spread, that's my best number. And, without that data, as the data comes in, as we have it, as the scientists learn more, as modelers far smarter than I am, put that together, we'll look back at this and we'll see where we were. But, so that is that answer. I want to say in closing, as I've always said about public health, the hard thing about this, we're working so tirelessly with our hospital system right now, but everything I learned in med school is just such a small part of all this fabric of things, from childcare to what we do in businesses. All of these things affect our life expectancy. They affect our health and well-being. 2/3 of these things that we have to solve collectively affect us. And so we're moving as best we can along with our fellow states, and you'll see it as best as each state can move given their unique circumstances. Those 2/3 of levers that we do, but 1/3 will be up to you. And so much will depend on us as citizens. We promise you the best information that we know as we know it. On our website, coronavirus.ohio.gov, we will keep posting things. You will see whole new worlds about what we do together. I know there are Facebook groups already deciding things. We know the most vulnerable are at risk. These decisions are not made lightly. They are not made lightly. We talk policy. Most of us have not slept a ton. We are talking policy walking here. We'll start talking policy on the way out. None of this is made lightly. And I just really want to say to our teachers out there one last thing. I was asked, teachers, you can still become a polling worker. Some of us, you'll see redeployment of whole workforces to help out in hospitals and do other things, much more coming. But teachers, you can actually train this weekend, and you can help out the polls if you're healthy. And we want to get people out to vote, voteohio.gov. Thank you.
Questions?
You mentioned before the restrictions that were taken with jails and with prisons. Have there been any suspected cases in any of the state's prison systems or the local prison systems? And is there testing available for them if there should be a suspect?
The testing will be available. I'm not aware of any. That doesn't mean there hasn't been. I'm not personally aware of that. But in regard to the prison, this was a recommendation that came through our director very early on. It seemed to be logical to extend it to the jails. It's the same basic principle. It's a more transient population in jails, but he still is pretty much the same situation.
Dr. Minor, could someone clarify the number?
Oh, I'm sorry.
Could you go through the numbers again? We're at 13.
Okay, you're talking about the confirmed cases, all right?
They're going to give you an update right at the end because the testing results are rolling in. So I'm going to let our comps people they're getting texts while I'm up here.
Dr. Acker, can you talk about people who want to donate blood? What is your recommendation for that? And can they screen for COVID-19? Can you talk about that?
That is something I'm not familiar with, so I'll have our team look into it. But blood will become an issue. It isn't right now from what I've heard, but please fact check me on that. But this will be an issue, and we were even talking about it recently. So that'll be one of the many things, the many creative things that are going. The creativity, including a baby boom, I would not be surprised, and a decrease in most infections because we're all washing our hands. But there will be things we learn from this, and doing blood should be a great thing, so stay tuned from Red Cross on that.
For the governor, Ohio's eviction courts are still open. Is that proven right now in the midst of an outbreak? Besides, the courts themselves are great for transmission of disease and putting people on the street during the day.
I talked to a juvenile court judge. I just happened to run into him, Adolfo Ternicio in Xenia, and he was telling me what procedures he was taking. You're seeing judges take steps. He felt that the other judges in Greene County, that's just anecdotal, that's one county, but look, everybody is taking steps, we believe, to separate people. So this is also, when you shut down, and that we're not going to elections, or you shut down the judiciary, it's probably about the last step that you would take. It would have to be a real emergency to do that. We have an emergency, but again, some of these cases can be delayed, and so again, this is a better question to the Chief Justice, but you're seeing courts make decisions about how important something is. If something is it can be postponed, you're starting to see courts do that. We would recommend them do that. If there's an urgency, some setting bail, many courts now, as you know, are doing that remotely anyway. Someone's locked up in the county jail. Most courts I'm familiar with, they're doing it by video anyway, so they don't have to move the prisoners. So again, everybody needs to be prudent. Everybody needs to do what needs to be.
Do you have thoughts on evictions specifically, though?
Thoughts on what?
Evictions.
Evictions. I do not have thoughts on evictions per se. Again, these would be things that one would assume could be pushed back. I mean, again, you know, the things that can be pushed back during this period of time. What you're going to run into is the difficulty of court personnel being there. You're going to run into, if anybody's talking about seating a jury, it's going to be difficult. So you have all kinds of problems. And I'm frankly, the Chief Justice has her hands on this. If she is seeing a problem that we need to have legislation to fix, then we certainly will go to the General Assembly to do that.
Governor, you know, a lot of Ohioans live paycheck to paycheck, shutting down the schools, and a lot of them will probably be laid off, at least temporarily. What is your best recommendation for them to, you know, make ends meet?
Well, these are things that we certainly are looking at. I've had some indication that you're going to see some things coming out of Washington. I talked to Rob Portman today. So, you know, look, this is a work in progress where we understand that this is going to be difficult for people. What we're trying to do, just as the announcement we made today in regard to food for children, we're trying to, as quickly as we can, put together the support systems that need to be there.
Governor, you had mentioned that daycares are not going to be closed, but have you given any consideration to weddings? A lot of people are worried about, you know, going to large weddings. Is that something you're still weighing, or do you think that will...
Well, we did not include, as you know, we did not include weddings and funerals. Again, we would, you know, a lot of this has to be citizens making rational decisions. And, you know, whenever you have a large group come together, there certainly is a danger there. I don't think government can, you know, we've already taken some very drastic actions. We may take more, but a lot of this is going to come down to the individual. Again, you can't write laws to cover every situation. You can't, you know, we were very aggressive in putting the number at 100 as far as people coming together. What happens if someone walks into I think example I used yesterday, someone walks into a small sports bar or small bar and everybody's crowded in together? That's not a good idea. Now, they legally can do it. It doesn't come under the order, but, you know, you have to be kind of crazy to stay in there. I mean, you know, people need to be just, you know, take some responsibility. And look, you're seeing that. When I'm out today, you know, I see people talking about it. I see people saying, hey, we need to keep this space. I mean, people are getting it. They understand. They're taking that responsibility.
We're also getting a lot of concerns about casinos and the large crowds there. Is anybody...
Casinos are under the same order as every other place. So if they're violating the order, you know, if there are over 100 people, that's a violation. And we would be very anxious to know about it if people are actually seeing that.
Could you talk about what enforcement would look like? Sorry. Could you talk about what enforcement would look like then going off that would be the jurisdiction of local law enforcement?
Well, again, I think we would probably be the ones that get the calls. And if you're talking about casinos, they come under the Casino Control Commission. And I know the Casino Control Commission is looking at this. And so the fastest way to get something done there would be simply for the Casino Control Commission to close that casino or to, make some orders, and the casinos have to follow those orders. So in each case, the enforcement's going to be different, and I think we have to look to what is the most effective. I get calls. I'm getting calls from mayors. I'm getting calls from people all the time, and sometimes they're saying, "Look, somebody told me this." So this information is coming into us in real time, and we're trying to take action when we're seeing it.
Director, you talked about, you mentioned that you're getting calls from doctors in Ohio, we can't get PPE. Can you give us a sense of what is the inventory? Do all the hospitals have enough PPEs to cover their nurses and physicians?
There is a group, as I had mentioned before, we put together a group of all the major hospital systems in Ohio, primary care associations, primary care practices, our team, our emergency preparedness team who work on this, our plan. And we've known all along there are shortages. I've heard that private doctors have placed orders but are not getting them filled. I think the major distributors, are conserving. We've been in conservation for a while now. The CDC has put out guidance on that, on how to do that. This is part of plans. We do have numbers on that. I'll let my Chief Information Officer give you those, because we are getting a little disbursement from the stockpile. We do have a stash of our own. It's a very small stash, but as you know, the CDC has been doing a lot of things, like they've asked us not to get rid of expired. They're pretty sure they'll still work. So a lot of us, many, many weeks ago, kept all our supplies. But there's a lot of movement going on around the PPE. And obviously, again, all of this is about keeping this, for the sickest folks. And, all of these methods, every kind. You'll see hospitals doing incredible things like the drive-through testing. You're going to see potentially, whole wings of hospitals set up separately. They're all, they're in there. I think that I left, they were still discussing their latest ideas, and then outside units. So whatever this brings us, the hospitals are all working together.
Dr. Evans, we're still very much on the precipice of this. At what point will we know if we have flattened the curve?
I think these numbers and the CDC will be tracking all this. They're also doing some very interesting, we've mentioned briefly, and another time I'll talk more about sentinel surveillance. Many of us are working in that. There'll be a point, and the CDC will probably guide us through that. We'll also have our numbers as a state. I have to say, doing a school measure, you're going to hear things like you should do it for at least 6 to 8 weeks. We've made the step we've taken so that we can better assess. We think we'll have more data. And so, while it could be a longer haul like the CDC sometimes predicts, we're really trying to grow with our understanding. So we're trying to be maximally flexible.
Governor, you received the USDA waiver, and then Lieutenant Governor showed us the letter that's going to the administration. What, if anything, in between those two have you requested from the federal government that you haven't gotten yet or is critical?
Let me ask if anybody knows. Kim, do you have anything that would not have been in the letter?
No, sir.
That includes everything we've asked for, but as I mentioned earlier, that will not be our last outreach to the administration.
We're going to, as we move forward, and as we're talking to superintendents, as we're talking to other people, we will find needs, we will find problems, we will find challenges where we need to get through the bureaucracy or the red tape, and where regulation, frankly, is getting in the way. And again, we start with the idea that this is an emergency, and we should not let regulations get in our way unless they're, basically have to do with safety of people.
Some states have expressed frustration.
We're going to go through the process, and we're going to do what we need to do.
Some states have expressed frustration with Washington's speed, but I'm not hearing that from you. Is that correct?
Well, look, they reacted, the Trump administration reacted in less than 24 hours for these two waivers that we wanted, and this was something we talked about just a day ago here. So look, we're going to be continuing to work with them, and we'll be on the phone. It's not just a letter. We'll be on the phone and trying to work these things out. Andy?
Governor, would you like to see some sort of paid family leave in Ohio?
Look, I think anything's on the table. As we don't know how long this is going to be. We need to look at all things. We're certainly in consultation with the leadership of the General Assembly. Nothing today on that, but it's something that we certainly could look at. Sure.
At what point do we quit testing, and is it when we run out of tests, or what? Where do we go with that?
Not soon enough. You know, the testing is really important to us right now because, you know, at the local health departments, they're very busy right now. You're going to hear as the news of different cases comes and all the contacts and all the layers upon layers. Eventually that becomes more than is feasible, and the CDC, you know, or others will guide us to, you know, it's time to not do that. As I've mentioned, eventually, most ill folks with this will stay home, and your doctor will tell you stay home. They might not even test you, and they'll just say, you know, this sounds a lot like coronavirus. Here's some guidance to get through it, you know, and they'll help you manage that at home. Eventually, the testing might become part of our respiratory panel, as I've said before. So that's all part of the wave that we're seeing as we move through these interventions.
Can you talk about, you know, we talked about people who may get laid off because of this. People have mortgages to pay. Should banks be giving waivers to people who may have difficulty either paying the rent, paying the mortgage? What should we do? What is your recommendation financially out there?
Well, we'd certainly recommend that banks do that. I mean, look, this is an extraordinary circumstance. It should not really reflect on anyone's credit. You know, if this a direct result of what we're going through and everybody's feeling this, it would seem to me to be prudent and the good thing to do for the banks or whoever else to take that into consideration. Yes, absolutely.
Governor, Michigan went ahead and canceled schools statewide, and also Governor Whitmer issued an order for mass gatherings of 250 or more. Other states surrounding Ohio have not done that. Are you in contact with other governors to ask them to kind of follow this plan?
Well, I've had conferences with other governors over the last several weeks. We have other conferences that are set up. We exchange ideas. But in the world we live in, you know, if Ohio does something, they know it within 30 seconds. So, you know, everybody is kind of, I'm sure, looking at what everybody else is doing. But ultimately, you know, my responsibility is, of course, to the people of the state of Ohio. But, you know, I have actually been on some national shows, and frankly, the only reason I took them is to say, look, this is what we're seeing in Ohio. This is why we are doing what we're doing. This may look aggressive. I had an interview last night, and the interview was, you know, how come you guys are doing this? You only have so many confirmed cases. And the answer was, look, here's what we're basing this on science. And so as we put that information out, just as I look at what other states are doing and listen to their rationale, I assume that other states are looking at us and to see what our rationale is, and we're very, very open about why we're doing it and what our rationale is.
Governor, the state of Louisiana today postponed its primary before the primary. Has there been any consideration or discussion about postponing Ohio's primary?
Well, I talked to the Secretary of State as late as this morning. We didn't talk specifically about that. We don't see any reason to do this. As I said, people were voting in Xenia, Ohio when I voted a few hours ago. We're telling people to be careful, but Ohio does have early voting, and it gives people an opportunity to kind of spread that voting opportunities out. We've already had a number of people who have voted. And I'm going to let the former Secretary of State address that, and particularly in regard to the problem if you would stop an election. I mean, this election has already started. It's been going on for a number of weeks. John?
Thank you, Governor. The election's already underway. Voting has started. People are making their decisions. It would be disruptive to the decision-making process. It does not represent a mass gathering. Remember that these are primary ballots. They're shorter ballots, so the efficiency with which people should go through and vote should be improved so that there are no circumstances where we have long lines or problems. That's why we've been asking for the poll workers. I know that just since yesterday, more than 500 people responded to the Secretary's website. He's building the capacity along with the local elections officials to make Tuesday run efficiently. And at this point in time, there does not seem to be a reason that you would want to do that, and understand the impact different in Louisiana. I don't believe voting has started in Louisiana yet. You'd be suspending an election right in the middle of voting, which brings its own challenges.
Dr. Acton, can you go talk again about your guesstimate of the 100,000? Are you saying that 100,000 people could be affected in Ohio at a certain date, or can you clarify what you meant by that?
You know, what we know is that we have community spread in Ohio, and what we know is that we have folks in ICU, so we have the hospitalization. Those things alone are usually triggers to consider. Our understanding of our cases right now and the numbers we have in Ohio, it's sort of like a star, like you see in the galaxy, and you know that the light travels over light years. So what you're actually seeing by the time you see it is delayed, it's the past. And that, in that same way, I feel like the numbers we're seeing in Ohio sort of reflect are a little bit lagging behind our understanding of rapid diagnostic, really being able to know, identify immediately and circle someone. And with the evidence we've seen of community spread, again, I will say in Ohio, we have had travelers, you know, from all over that came through the 11 airports. We know some people got here that somehow didn't get through that process. We have had every cruise ship imaginable. We have Nile River. We've had people that we had known sources. We have people that will be coming back to Ohio, 33 people from the I believe the Grand Princess, the other ship. They range in age from 30 to 92. They're going to be coming back on a charter plane. We have wraparound for them. It's covered. We have local health departments who will monitor them and quarantine them. So we've been doing this work all along, but what we haven't known is, you know, we had our APEC traveler who was on a school bus, and there were 100 people on that school bus, and then they all went about their business. By the time we knew about APEC, we didn't know who all, and so then you get a random person in a random county, and you just can't connect them back anymore. And so we're seeing this, it's going to feel a lot like whack-a-mole. It's going to be all over every county. We already had schools closing in small counties that had people, so many people under investigation that it became, you know, an issue to deal with. And a lot of these decisions, I have to tell people, we're asked to make them because the need for, if you do these things too intermittently, they don't work, just like the Swiss cheese. And sometimes different industries come to us and say, we need clear guidance. We need to do this uniformly as an industry. So sometimes the orders we do are very helpful to the people we're doing the orders on. They're meant to be providing that guidance across the state uniformly. So I'll go back. I think you can watch the repeat of my numbers, and I can show you my card. Thank you.
Dr. Acton, can you speak about the cases in Cincinnati and if they're being followed after being confirmed?
That would be the local health department, so, and the hospital.
Governor, you mentioned your lack of
toilet paper for a minute.
That was garbage.
The other night,
Come on. Toilet paper, okay.
Why is that? And what would you tell people about panic buying?
This was the young lady that you and I were standing by. Is that she had a little extra toilet paper she was taking home, I guess. Well, I would tell people to be prudent, and we're all in this together. So if you go in and wipe out a whole shelf of whatever something is, it's probably not helpful to your friends. You know, buy what you need. You know, we've told people for some time that they need to kind of, you know, have an emergency, food and other things. So, you know, over time they can certainly accumulate that. But, you know, we're all in this together. Don't go taking other people's stuff and just you know, doesn't make any sense.
Governor, you mentioned relaxing regulations.
I'll remember that, Mr. Oddie. So, yeah, good. Thank you for the toilet paper question.
You mentioned relaxing regulations when it comes to the daycares and the ratio there. Are there more details about what that's going to look like?
Yeah, we'll have more details. I don't know, Kim, if you want to share anything now.
Yes, thank you. We will have information out here shortly in alignment with the emergency rules. We heard from the industry that they were looking for at least a 20% or so degree of flexibility on the ratios, and what we're proposing and planning to implement would be slightly above that. So we're hopeful that that would give a little bit of breathing room such that if you have an instructor that's out, you can leverage your remaining instructors across your classrooms with slightly larger, we're not talking significant increases, but with slightly larger numbers of children there in the room, such that the providers can still provide the service, and then parents that need to go to work and avail themselves of the child care still have that resource.
And this is an example of something that we're going to have to, we will continue to monitor, and you'll continue to have to make decisions about them. Anybody else?
Governor, could you talk about if you have any concerns that participation returning to the election in that or the upcoming census, I guess ongoing now, might be lowered by this? For example, in rural parts of Ohio where people might have been more reliant on libraries for internet access to do that online, those might be closed now?
Well, I'm not going to comment about the census, but as far as the voting, I would just encourage people to vote. You know, I've been running for office a long time, and I never can predict what the vote turnout's going to be. This is a different circumstance, certainly, but, you know, people are voting right now all throughout Ohio. As I said, I saw people standing in line in Xenia, not a long line, but they stood in line for a little bit. And so people are showing up, they're voting, and it's just important. I mean, it's important that people continue to do this. They can take, you know, the normal precautions that they need, or the extraordinary precautions that they need to make sure that they don't have a problem. Just everybody needs to be careful, but that's true, you know, going to the grocery store. That's true whatever people are doing. They just need to be careful. Voting is just one more thing, but it's certainly a very, very important civic duty, and I would urge everyone to, you know, to go out and vote. It's important.
Governor, Ohio State University is telling its students to leave the dormitories. Are other public universities going to be doing the same?
You know, I don't have any update on that. What they're going to do. Anybody else? Okay. Thank you all very much. Thank you.
Can we get those updates?
Just wrapping up a news conference there with Governor Mike DeWine, and of course, Amy Acton, Dr. Amy Acton, talking about some updated numbers now here.
Well, and those numbers are going to continually be updated, but she says 9 males, 5 females in the state, ranging in age from 34 to 66 with a median age of 48. First infection February 25th, the most recent on March 11th. 159 cases investigated. 50 of those are negative so far.
But what was interesting, though, Brad, is how she talked about 4 people in the hospital, no deaths here in the state of Ohio, 6 counties affected here in Ohio.
4
most
more,
recent case yesterday,
4
Trumbull
more in
County.
Cincinnati.
Yeah.
And they have those at UC Westchester Hospital in Cincinnati. So what they are doing is continually updating where they're going. She says she apologizes for going viral and talking about the 1%. All of these are guesstimates at this point.
Right, because she did say that she called them the disease detectives are working 12-hour shifts right now. And thank goodness we have some kits now here in the state of Ohio where people they have 500 tests every single day, but you have to have a doctor's order to be tested.
Yeah, some of those things that we are talking about. A doctor's note, if you think that you were exposed, if you don't have the flu, if you have traveled outside the country, you probably need to be active in getting tested. She talked about being ill, staying home. The common sense thing, being ill and staying home.
We've got to toss right now because President Donald Trump is speaking. Let's listen in right now.
Thank you very much, everyone. Thank you. Thank you. Beautiful day in the Rose Garden. Appreciate everybody being here. Today I'd like to provide an update to the American people on several decisive new actions we're taking in our very vigilant effort to combat and ultimately defeat the coronavirus. We've been working very hard on this. We've made tremendous progress. When you compare what we've done to other areas of the world, it's pretty incredible. A lot of that had to do with the early designation and the closing of the borders. And as you know, Europe was just designated as the hotspot right now, and we closed that border a while ago. So that was lucky, or through talent, or through luck, call it whatever you want. But through a very collective action and shared sacrifice, national determination, we will overcome the threat of the virus. I also announced Wednesday night, following the advice of our medical professionals, who are doing a tremendous job, and we appreciate it very much, that we're suspending the entry of foreign nationals who have been to Europe in the last 14 days from entering the United States. Citizens, permanent residents, and our families, any of the families returning from Europe, will be subject to extra screening as well as self-isolation for a period of 14 days. As the World Health Organization confirmed today, many of the things that what we said were 100% correct, including our designation before them of Europe. Like our earlier very aggressive actions with China, this measure will save countless lives. I appreciate a number of the folks behind me, number of the people behind me said that that saved a lot of lives, that early designation. But it is only the beginning of what we're really doing, and now we're in a different phase. We had some very old and obsolete rules that we had to live with. It worked under certain circumstances, but not under mass circumstances. They were there for a long time, they were in place for a long time, and we're breaking them down now. And they're very usable for certain instances, but not for this. To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency. Two very big words. The action I am taking will open up access to up to $50 billion of very important and a large amount of money for states and territories and localities in our shared fight against this disease. In furtherance of the order urging every state to set up emergency operation centers effective immediately. You're going to be hearing from some of the largest companies and greatest retailers and medical companies in the world. They're standing right behind me and side of me. I'm also asking every hospital in this country to activate its emergency preparedness plan so that they can meet the needs of Americans everywhere. The hospitals are very engaged. New York and various other places are also very engaged. I just spoke with Governor Cuomo. We had a very good conversation, and we're working very strongly with many states, including New York. The emergency orders I'm issuing today will also confer broad new authority to the Secretary of Health and Human Services. The Secretary of HHS will be able to immediately waive provisions of applicable laws and regulations to give doctors, all hospitals, and healthcare providers maximum flexibility to respond to the virus and care for patients. This includes the following critical authorities: the ability to waive laws to enable telehealth, a fairly new and incredible thing that's happened in the not so distant past. I tell you, what they've done with telehealth is incredible. It gives remote doctors visits and hospital check-ins, the power to waive certain federal license requirements so that doctors from other states can provide services in states with the greatest need. Number two, the ability to waive requirements that critical access hospitals limit the number of beds to 25 and the length of stay to 96 hours. The ability to waive the requirements of a 3-day hospital stay prior to admission to a nursing home, big thing. The authority to waive the rules to hinder hospitals' ability to bring additional physicians on board or obtain needed office space. They can do as they want. They can do what they have to do. They know what they have to do. Now they don't have any problem getting it done. The authority to waive rules that severely restrict where hospitals can care for patients within the hospital itself, ensuring that the emergency capacity can be quickly established. We'll remove or eliminate every obstacle necessary to deliver our people the care that they need and that they're entitled to. No resource will be spared, nothing whatsoever. 10 days ago, I brought together the CEOs of commercial labs at the White House and directed them to immediately begin working on a solution to dramatically increase the availability of tests. Other countries have called us and worked with us, and they're doing similar things or will be doing similar things. As a result of that action, today we're announcing a new partnership with private sector to vastly increase and accelerate our capacity to test for the coronavirus. We want to make sure that those who need a test can get a test very safely, quickly, and conveniently, but we don't want people to take a test if we feel that they shouldn't be doing it. And we don't want everyone running out and taking, only if you have certain symptoms. Using federal emergency authorities, the FDA approved a new test for the virus. We did this within hours after receiving the application from Roche, a process that would normally take weeks. We therefore expect up to 500,000 additional tests will be available early next week. We'll be announcing locations probably on Sunday night. I want to thank Roche, great company, for their incredible work. Thank Thermo Fisher. The FDA's goal is to hopefully authorize the application within 24 hours. It'll go very quickly. It's going very quickly, which will bring additionally 1.4 million tests on board next week and 5 million within a month. I doubt we'll need anywhere near that. At the same time, we've been in discussions with pharmacies and retailers to make drive-through tests available in the critical locations identified by public health professionals. The goal is for individuals to be able to drive up and be swabbed without having to leave your car. I want to thank Google. Google is helping to develop a website. It's going to be very quickly done, unlike websites of the past, to determine whether a test is warranted and to facilitate testing at a nearby convenient location. We have many, many locations behind us, by the way. We cover this country and large parts of the world, by the way. We're not going to be talking about the world right now, but we cover very, very strongly our country, stores in virtually every location. Google has 1,700 engineers working on this right now. They've made tremendous progress. Our overriding goal is to stop the spread of the virus and to help all Americans who have been impacted by this. Again, we don't want everybody taking this test. It's totally unnecessary. And this will pass. This will pass through, and we're going to be even stronger for it. We've learned a lot. Tremendous amount has been learned. I want to thank Deborah Birx, and I want to ask her maybe to come up and say a few words as to what's happening. Dr. Birx is a highly respected person I've gotten to know very well over the last 6 days. And what we've done is rebuilt something that was very old-fashioned, somewhat obsolete, certainly obsolete when it comes to the kind of numbers that we're talking about. Dr. Birx, please. Thank you, Deborah.
Thank you, Mr. President. It's a pleasure to be here with all of you. I think you know at the beginning of this epidemic, HHS through CDC proactively developed an assay built on the existing flu surveillance system. That surveillance system was then converted to diagnostic system. But last Tuesday, seeing the spread of the virus around the globe, the President realized that our current approach to testing was inadequate to meet the needs of the American public. He asked for an entire overhaul of the testing approach. He immediately called the private sector laboratories to the White House, as noted, and charged them with developing a high-throughput quality platform that could meet the needs of the American public. We are grateful to LabCorp and Quest for taking up the charge immediately after the meeting, and within 72 hours, bringing additional testing access, particularly to the outbreak areas of Washington State and California, and now across the country. We are also very grateful to the universities and large hospital systems that took up the charge to develop their own quality tests made available by new FDA guidance. This has resulted in expanded testing across New York, California, Washington, Colorado, and you see sometimes those drive-through options that have been made available through these high-throughput options. Following the meeting last week, major commercial laboratory equipment and diagnostic companies took immediate action to adopt and develop new testing systems. Last night, the initial company, Roche, received FDA approval, moving from request to development to approval in record time. This innovative approach centered fully on unleashing the power of the private sector, focusing on providing convenient testing to hundreds of thousands of Americans within short turnaround times. In less than 2 weeks together, we have developed a solution that we believe will meet the future testing needs of Americans. I understand how difficult this has been. I was part of the HIV/AIDS response in the 80s. We knew from first finding cases in 1981, it took us to almost 1985 to have a test. It took us another 11 years to have effective therapy. It is because of the lessons learned from that we were able to mobilize and bring those individuals that were key to the HIV response to this response. And I understand that a lot of this behind-the-scenes action over the last couple of weeks was invisible to the press and the American people. But this intense effort has not only resulted in innovative solutions, but an automated, high-throughput system bringing the availability of these quality coronavirus testing to the American people at unprecedented speed. Finally, I want you to know in South Korea, they did have a large number of tests available over the last several weeks. Their positivity rate is between 3% and 4%. With LabCorp and Quest expanded testing, their positivity rate is between 1% and 2%. So we want to also announce this new approach to testing, which will start in the screening website up here, facilitated by Google, where clients and patients and people of interest can go, fill out a screening questionnaire, move down for symptoms or risk factors, yes. They would move down this and be told where the drive-through options would be for them to receive this test. The labs will then move to the high-throughput automated machines to be able to provide results in 24 to 36 hours. That is the intent of this approach. We have seen it work just in our own United States, and we want to bring this across the continent. Thank you very much.
Thank you very much, Brett. I'd like to maybe have Tony, do you want to come up? You've become I think everybody out here knows you pretty well, but Tony has been doing a tremendous job working long hours, and you've seen a lot happen, but this has been, it's been a great experience, and working with you has been terrific. Tony, please.
Thank you very much, Mr. President. This is an example of, another example of what I've been referring to in my discussions with many of you in the audience as a proactive, leaning forward, aggressive, trying to stay ahead of the curve. And what you're seeing now with this order is that we're going to be able to remove the constraints so that people at the state, the local level, the individual physician, all the way up through the federal government will have as many constraints as possible removed for them to do everything they possibly can so that we can implement the things that we've been talking about. The containment, the mitigation, so that, as I've said many times, that curve that I refer to that goes up, we don't want to have that curve. We want to suppress it down to that small mound. And I think what we've done today is something that is going to be a very important element in having us be successful in doing that. We still have a long way to go. There will be many more cases, but we'll take care of that. And ultimately, as the President said, this will end. But what's going on here today is going to help it to end sooner than it would have. Thank you.
Thank you very much, Tony. If I could, some of these folks we know, they're celebrities in their own right. They're the biggest business people, the greatest retailers anywhere in the world, and one of them is Doug McMillan from Walmart. And I'd like to have Doug, if you would, say a few words, wherever you may be. Good, Doug, please.
when we got the call yesterday from the White House, we were eager to do our part to help serve the country. And given what we're facing, that's certainly important to do. We should all be doing that. So we've been asked to make portions of our parking lot available in select locations in the beginning and scaling over time as supply increases so that people can experience the drive-through experience that the President described. We'll stay involved and do everything we can from a supply chain point of view to be of assistance. Thank you, sir.
Thank you very much, sir. Appreciate it very much. I'll just stay right.
And this situation is no different. So we look forward to partnering with the CDC, the administration, HHS, and the task force, and specifically to the Vice President's doing such a fantastic job. We're ready to engage and help. Thank you.
Thank you very much. Great job. Thank you very much. Brian Cornell, Target. Thank you, Brian. Thank you, please.
Well, Mr. President, thank you for inviting us here today, along with our colleagues from Walmart and Walgreens and our partners at CVS. Normally, you'd view us as competitors, but today we're focused on a common competitor, and that's defeating the spread of the coronavirus. And we look forward to working with the administration to do our fair share to alleviate this growing threat. So thank you for including us today. In the near term, we're all committed to making sure we're keeping our stores open to serve the American consumer who's rapidly stocking up on household essentials, key food and beverage items that they need during this time, making sure we run safe stores and create an environment that's safe for our team members, making sure that they feel supported during this very critical time. So thank you for including us.
Thank you very much. Great job. Great job. Is Tom here? Tom Poland? Tom Poland, please.
Thank you, Mr. President. As CEO of Becton Dickinson, we're one of the leading providers of medical devices as well as collection products for testing of coronavirus. We're ramping up our manufacturing capacity to ensure that the right collection devices and testing equipment are ready to address this issue. Thank you, Mr. President.
Thank you very much, Tom. Great job you've done. Stephen Rakowski, Quest Diagnostics, please. Great job. Thank you very much.
Thank you very much. Thank you, Mr. President. So as mentioned, we were called with the leadership of the Vice President last week to come together as an industry. And we took advantage of that opportunity to work with the FDA, to work with the Center for Disease Control. And we are up and running with tests in a number of our facilities. As the President mentioned, we now have capabilities from Roche Diagnostics that we will bring into our facilities this weekend. And I know myself and my colleague at LabCorp will be doing the same. So the capacity available to the American public to support this action with consumers will be considerably increased in the next few weeks. Thank you, Mr. President.
Thank you very much. I appreciate it. Thanks. And Matt Sauce, please, of Roche. Matt, thank you, Matt.
Thank you, Mr. President. So from Roche, we want to thank the FDA for their rapid approval of our coronavirus test. We really appreciate the partnership with the CDC and the FDA to get that to market as fast as possible, because it's critical for us to make that available to help patients in need, and working with laboratories to get it up and going in the near future, which will bring hundreds of thousands of tests available to patients in need in the United States. So thank you.
And you can do it. You can do it. Great company. David Pierre of Signify Health, please. Thanks, Dave.
Thank you, Mr. President. We are the largest house call provider in the U.S., and we go to the homes of the most vulnerable elderly. And through our network and our logistics engine, we stand ready to help and provide our clinicians to be where they're needed, whether they're in retail clinics or in the home, and we're here to assist. Thank you very much.
Thank you very much. And we'll be changing a lot of the rules, regulations for future, should this happen in the future, which we hope it never does, but it will, I guess, somewhere out there. There's some bad ones over the years, and I guess that'll continue to an extent, but we hope it never happens. But we're going to be changing a lot of the old rules and specifications and regulations. Adam Schechter, who's really been of tremendous help, LabCorp, please. Adam.
Thank you, Mr. President. At LabCorp, we're working every second of every day to increase the number of tests that we can run. We're working with academic medical centers, with our colleagues at Quest, with other hospital and other laboratories to ensure that we do everything we can to increase the testing as we move forward. And I can tell you we understand how important the testing is, and we are committed to doing everything possible.
Thank you very much. Great job. Thank you. Thomas Moriarty, CVS. We all know CVS. Thank you. Thank you, Thomas.
Thank you, Mr. President. We have been focused since the start of making sure our patients and the customers we serve have the information they need, the safety they need as well. We are committed to working with the administration and local public health officials to make this work as well. And thank you, sir, for the honor.
Thank you very much. Thank you. Thanks. Great job. And Bruce Greenstein, LHC Group, tremendously talented people. Thank you very much.
Mr. President, thank you for the honor of being here. And the home health industry has been treating patients and seniors in the safety and comfort of their own home for decades. We're very proud to be part of the equation for testing in their own home. For Americans that can't get to a test site or live in rural areas far away from a retail establishment, we're here to help and to partner with our hospitals and physicians as well as the people we have here today that will be doing testing around the country. Thank you.
Thank you very much. Good test.
We'll practice that.
Okay, I like that. That's good. We're also announcing the following emergency executive actions today. To help our students and their families, I've waived interest in all student loans held by federal government agencies, and that will be until further notice. That's a big thing for a lot of students that are left in the middle right now. Many of those schools have been closed. Based on the price of oil, I've also instructed the Secretary of Energy to purchase, at a very good price, large quantities of crude oil for storage in the U.S. Strategic Reserve. We're going to fill it right up to the top, saving the American taxpayer billions and billions of dollars, helping our oil industry and making us even further toward that wonderful goal which we've achieved, which nobody thought was possible, of energy independence. It puts us in a position that's very strong, and we're buying it at the right price. And that's something that would have not even been possible a week ago. The price of oil went down quite a bit, so we're going to fill it up. It's a good time to fill it up. I'd like to ask Mike Pence to say a few words, please. VP.
Thank you, Mr. President. It is this day should be an inspiration to every American, because thanks to your leadership from early on, not only are we bringing a whole of government approach to confronting the coronavirus, we're bringing an all of America approach. Mr. President, from early on, you took decisive action. You suspended all travel from China. You created travel advisories, South Korea and Italy. We screened all travelers from all airports in both of those countries. And on the unanimous recommendation of your health experts, you, at midnight tonight, will effectively suspend all travel from Europe, and Americans that were returning will be screened and asked to voluntarily participate in a 14-day quarantine. Throughout this process, Mr. President, you've put the health of America first, but you brought the best of America to address it. And it's not just at the federal level. As you said, Mr. President, we've been working with states across the country. We issued broad guidelines from CDC for every American. But this week, at your direction, we tailored specific recommendations from CDC for New York, Washington State, California, Massachusetts, and Florida. And we've been in continuous contact, as you said, with governors around the country. And Mr. President, you have forged a seamless partnership with every state and every territory in this country to put the health of our nation first. But today, I trust that people around the country that are looking on at this extraordinary public and private partnership to address the issue of testing with particular inspiration. After you tapped me to lead the White House Corona Task Force, Mr. President, you said, this is all hands on deck. And you directed us to immediately reach out to the American business sector, commercial labs, to meet what we knew then would be the need for testing across the spectrum. And today, with this historic public-private partnership, we have laid the foundation to meet that need. For Americans looking on, by this Sunday evening, we'll be able to give specific guidance on when the website will be available. You can go to the website, as the President said. You'll type in your symptoms and be given direction whether or not a test is indicated. And then at the same website, you'll be directed to one of these incredible companies that are going to give a little bit of their parking lot so that people can come by and do a drive-by test. And Mr. President, I want to join you in thanking Walmart and CVS and Target and Walgreens These are companies that are synonymous with communities large and small, where people come together, and now they're going to come together to meet the needs of the American public. These commercial laboratories, LabCorp and Quest and Roche, have just done an incredible job stepping forward, and they're going to literally make hundreds of thousands of tests available and being processed with results to patients in the very near future. But it's all a result of you tasking us with bringing together not just government resources, which all state labs can now test across the country. CDC is testing. But you said, Mr. President, that we wanted to bring all the resources of the country together, and that's what this partnership really means. You know, the truth is that we have coronavirus cases now in 46 American states. And while the risk of serious illness of the coronavirus remains low, we want to encourage every American to practice common sense, practice good hygiene, go to the CDC's website to see what the guidance is for your community or for the American people broadly. And as the President has said, it's especially important now that we look after senior citizens with chronic underlying health conditions. Last week, the President directed the Center for Medicaid and Medicare Services to raise the standards at our nursing homes, increase inspections at our nursing homes. And today we're offering very specific guidance, which Seema Verma will articulate about visitations at nursing homes. It's important to remember that they were there for us when we were growing up, Mr. President. They helped us with our homework. They tucked us in at night. They cheered us on as we pursued education, cheered us on in our careers, and now it's time for us to be there for them and to recognize that seniors with chronic health conditions are the most vulnerable, and Americans can make a difference. So wash your hands, use common sense, look after the most vulnerable. And Mr. President, I know I join you in saying that every American should be proud of this incredible public-private partnership that's going to be speeding access of testing to millions of Americans in the weeks ahead. And together, as you've said many times, together we'll get through this. Together we'll put the health of America first.
Thank you.
America first.
Thank you. Seema, where's Seema? I'd like you to maybe take that a step further, please, on nursing homes. Thanks.
Thank you. Well, thank you to the President for the declaration. It allows my agency, CMS, that runs Medicare and Medicaid and has oversight of all of the nation's healthcare facilities, to suspend regulations that could get in the way of treating patients during this time. These temporary national blanket waivers are reserved for the rarest of circumstances, and they represent a massive mobilization of our country's resources to combat this terrible virus. And the flexibilities we are offering will be a godsend to the providers, clinicians, and facilities on the front lines of this fight. And later, CMS is going to be issuing guidance directing nursing homes to temporarily restrict all visitors and non-essential personnel, with a few exceptions such as end-of-life situations. We fully appreciate that this measure represents a severe trial for residents of nursing homes and those who love them, but we are doing what we must to protect our vulnerable elderly. Thank you.
Thank you very much. As I said in my address to the nation the other night, all Americans have a role to play in defeating this virus. Our most effective weapon right now is to limit the damage to our people and our country and slow the spread of the virus itself. The choice we make, the precautions we put into place are critical to overcoming the virus, reducing its spread, and shortening the duration of the pandemic, which is what it is. The CDC has published guidelines on the coronavirus.gov to enable its coronavirus.gov. And it's very heavily used right now, I will say, to enable every American to respond to this epidemic and to protect themselves, their families, and their communities. While the risks to young and healthy Americans remains very low, we've learned a lot about this over the last 2 weeks. Anyone can be a carrier for the virus and risk transmission to older Americans and those with underlying health conditions, and those who are most at risk. They have not done very well. Older Americans who are, especially if they have a health problem, they have not done well. We must take all precautions and be responsible for the actions that we take and that we see other people take. We want to prevent the spread and transmission of the disease. It's incredible what's happening with the sporting world, where so many of the great sports that we've gotten so used to at this time of the year, they're not going to be meeting, and they've done a great service, actually, but that would be another way that it could be, problems could be caused. But this is why I outlined on Wednesday night my administration's the fact that we've issued a requirement suspending all medically unnecessary visits to various places, but in particular nursing homes. We should all be working off the same playbook when it comes to protecting Americans. We have to. We need to be consistent in adopting measures to limit the spread of the virus. The virus is the same whether it's spreading in cities, towns, or rural communities. The tools and tactics for attacking it are similar no matter where you go. No matter where you go, you have some hot spots throughout the world right now that people would have never thought possible. They're being very seriously affected. Key among these efforts are breaking chains of transmission between people. These measures have been adopted by many companies, universities, and schools. And we want to protect the safety and the health of their employees and their students. I encourage everyone to follow the guidelines we've issued by CDC and these common sense measures. A lot of it's common sense. For the areas where the virus is spreading, the CDC is advising communities to postpone large gatherings, postpone assemblies, social functions, and sporting events, stagger recess and lunch for schools that aren't canceled, limit in-person meetings, increase scheduled cleanings, and cancel work, sponsored travel, among numerous other steps that can be taken. Americans are the strongest and most resilient people on earth, and in the coming weeks, we will all have to make changes and sacrifices, but these short-term sacrifices will produce long-term gain. And again, I've said we're learning a lot for the future, and future problems like this, or worse, it could get worse. The next 8 weeks are critical. The next 8 weeks are critical. We can learn, and we will turn a corner on this virus. Some of the doctors say it will wash through, it will flow through. An interesting term. And very accurate. I think you're going to find in a number of weeks it's going to be a very accurate term. In times of hardship, the true character of America always shines through. We live in the company of the greatest heroes and the most inspiring citizens anywhere in the world. We want to take care of our people. We want to draw on the strength of our history, draw on the strength of our people, and we will get through this all together. We will just get through it. So much progress has already been made. And frankly, the numbers, because of steps that have been taken, are at a level that a lot of people are surprised, especially when you compare them with other places with far smaller populations. The spirit and the will of our nation is unbreakable. We will defeat this threat when America is tested. America rises to the occasion. And to those families and citizens who are worried and concerned for themselves and their loved ones, I want you to know that your federal government will unleash every authority, resource, and tool at its disposal to safeguard the lives and health of our people. So we're with you every step of the way. No nation is more prepared or more equipped to face down this crisis. As you know, we are rated #1 in the world. We're also helping other nations. Many other nations, we're helping them a lot. And they're doing okay in some cases. In some cases, they're not doing well at all. But we're working with a lot of groups of people and a lot of other nations. With faith and heart and hope and love and determination, we will succeed, we will prevail, we will be very, very successful, and we'll learn for the future. Thank you all very much. If you have any questions, we can take some. Go ahead, John, please. And if you'd like to ask some of the folks up here, it would be fine, please.
Sure. Mr. President, where are you with the House bill? Yesterday we talked to you in the Oval Office. You were opposed
starting in
to
just
it.
a couple
What
of
has happened
minutes.
since then?
Now, breaking news from NBC.